Hello, my name is Walid, and I'm the representative of Group 6. And today I will be presenting on the topic that is drug abuse. And our group members are Muhammad Atif Ramzan, Daniel Sheikh, Walid, Yaf Khan, Sayyid Amir Ali Jafri, and Nematul Ahmad Haris Khan. Now we move towards the contents of our presentation. So here's a quick overview of our presentation. Uh, I'll begin with an introduction, objectives and definitions. Then I'll discuss the effects of drug abuse on society, statistics in Malaysia, a reading summary and philosophical analysis from three major religions. I'll also look at Rukun Nigara principles, share our group reflections, and finally propose solutions and a conclusion. Introduction. So, the drug abuse has become one of the most urgent social, philosophical, and health related challenges in today's world. And it threatens not just individual well being, but also the economic stability and social fabric of society. In Malaysia and across the globe, drug abuse contributes to crime, poverty, and family breakdowns. Addressing it requires awareness, prevention, and compassion, not just punishment. Objectives. So, the main objective of our study is to understand why drug abuse is increasing and what social and psychological factors contributing to it. We focus on peer pressure, stress, ignorance, and drug availability as key causes. And we also aim to highlight the importance of prevention, awareness, and rehabilitation. Rehabilitation programs that help people recover and reintegrate into society. The definition of terms. So let's clarify some key terms. Drug abuse means the harmful use of psychoactive or illegal substances. Addiction is a brain disorder where people continue using drugs despite the damage it causes. Prevention includes education and early interventions before use begins. So, rehabilitation helps people recover physically and mentally from addiction. And, and the harm reduction aims to reduce the negative effects of drug use, like providing clean needles or safe treatment access. Finally, I'll say that replace relapse means falling back into drug use after a period of abstinence. The effects of drug abuse in the society. So the effects of drug abuse go far beyond the individual. First, it increases crime. Many addicts turn to theft or drug dealing to fund their addiction. Second, it damages health systems, leading to more cases of HIV, hepatitis, and chronic diseases like liver and lung damage. Third, it weakens social and community stability. Communities with high drug use often face uh, uh, property decline and family breakdowns. In short, we can say that drug abuse creates a cycle of illness, poverty, and crime that impacts everyone. This slide is about the statistics, the drug abuse in Malaysia from 2019 to 2014. According to the AADK, Malaysia had around 140,000 drug abuse cases in 2019. And during the pandemic, numbers dropped slightly to about 120,000 to 123,000. But since 2022, uh, cases have risen again, reaching 128,000 in 2022 and 145,000 in 2023. So this shows that the issue remains serious. The highest risk group is late secondary school youth, where experimentation often begins. Sources include the Channel News Asia, Malay Mail, Malaysia's Open Data Portal, and the Asian Drug Monitoring Report. Next slide. So the next slide is about the. So the next slide is about the reading summary. This is the reading summary. Okay, so the Channel News Asia reports in 2025, it shows that youth addiction to new psychoactive substances like K-pods is increasing in Malaysia. The focus is shifting from criminal punishment to health-based rehabilitation. Another report highlights the gender and regional differences in drug abuse, calling for state-led awareness programs and better community engagement. And this slide is about the philosophical analysis, which I considered the main slide of this presentation. So first we will discuss on the Islamic perspective. So Islam emphasizes hifz al-aql, the preservation of intellect. And the Holy Quran prohibits intoxicants in Surah Al-Ma'idah. Verse 90 is stating they lead to sin and harm. Drug abuse breaks the divine trust of amana we have over our bodies and minds and harms the ummah, our community. So now we will discuss the Buddhist perspective. Buddhism teaches the fifth precept, which forbids intoxicants. Addiction is seen as tanha or craving, one of the roots of suffering. True peace comes from mindfulness and balanced awareness, not from altered states. So now we will discuss on the Christian perspective. So Christianity views the body as the temple of the Holy Spirit, meaning it must be respected and protected. The faith teaches redemption and restoration, encouraging society to respond with compassion, not judgment, towards those struggling with addiction. The next slide. This is about the Rukun Nigara analysis. The rule of law. Uh, the rule of law ensures justice and safety. Laws should punish traffickers but support users through treatment and rehabilitation. Effective enforcement includes data driven policing, border control, and fair trials that build public trust. Number two is mutual respect. Number two is about the mutual respect. Mutual respect and good social behavior. This principle reminds us to treat people with dignity and compassion. Addiction should be viewed as a health issue, not a moral failure. Schools, workplaces, and communities must promote education, empathy, and anti-stigma campaigns. Peer mentoring, parenting workshops, and recovery stories can help create a supportive culture. So the next slide is about the group reflection on the issue. As a group, we realize that drug abuse is not just a personal choice, It's influenced by social, economic, and psychological factors. It starts small, curiosity, peer pressure, or stress, and then grows into dependency that affects families and society. We also learned that prevention is more cost effective than treatment. Removing stigma is key so people can seek help early. Now, a strong partnership between government, law enforcement, health services, and communities is necessary for the success of drug abuse. Next, the group reflection on this assignment. So, working on this assignment was a great learning experience. We faced some challenges in deciding the focus, but through communication and teamwork, we reached agreement. Each member contributed based on their strengths, research, analysis, and design. And I must say that we learn about academic honesty, time management, and how to balance diverse viewpoints. Most importantly, we discover that collaboration strengthens both our learning and our unity. Solutions, a multifaceted approach. So, to fight drug abuse effectively, we need a comprehensive strategy. Number one is a robust prevention. Educate youth through schools and families about the dangers of drugs, build life skills and resilience to resist peer pressure. And number two is accessible treatment. Ensure affordable, integrated care that includes mental health services and long term counseling, support meditation assisted treatment, MAT, and peer recovery programs. It is about the pragmatic harm reduction. Distribute naloxone to prevent overdose deaths and offer clean syringe programs to reduce disease spread. Number four is about the smart policy reform. Shift focus from punishment to public health. Decriminalize minor drug possession to reduce stigma and encourage rehabilitation instead of incarceration. Next slide. Okay, so finally we reached the conclusion. So, in conclusion, drug abuse is a deeply rooted social and health crisis, but it's not hopeless. The goal is not a perfectly drug free society, but one that's free from the worst harms of addiction through prevention, treatment, compassion, and policy reform. We can rebuild lives and communities. Every act of awareness and kindness brings us closer to healing. And thank you. So the references which I use, our references include credible sources such as Channel News Asia, Malay Mall, and Plus One, providing recent data and academic research, supporting our analysis. Supporting our analysis. So thank you for watching our presentation. I hope it raises awareness about the seriousness of drug abuse and the importance of compassion and prevention. So goodbye and stay safe.